recap. We're looking internally.
This is a
sort of.
this is a diagram.
This is a diagram.
Took me a second.
This is the blue right here. This is showing the male anatomy. This is showing the female anatomy. There's the pubic bone, the bladder, the uterus, the cervix opening, the vagina, so the vaginal introitus, and then penis, testes, vas deferens, all those different structures. Just kind of showing this is actually a vaginal coitus, a diagram showing that. And my thing is not working. Okay, hormones and sex. So certain hormones are needed for sexual behavior. Okay, so and there's physiological things that may not even happen if the right levels of those hormones are not there. Central effects, that means the hormones act on the brain, so that's what they do. They actually have effects on the brain. Peripheral effects means these key hormones have effects on either the sensitivity or the growth of peripheral tissues, so they're needed for both peripheral and central effects. Proper hormone levels and proper arousing stimuli are needed for the human sexual response. And actually, a lot of people may not realize this, but the female sex drive, actually androgens secreted by the adrenal gland. So there's androgens that come from the adrenal cortex, and also estradiol and testosterone that come from the ovaries. Those are involved in sex drive or libido. Okay? And then the male sex drive comes from testosterone that's converted actually in the brain to estradiol. So remember, there's enzymes that actually can convert estrogen to testosterone and testosterone to estrogen. So testosterone levels are needed in the male for normal sex drive or libido. They're actually converted, testosterone is actually converted to estradiol in the brain. And that's what exerts the effect sort of on the overall sex drive in the brain. Yeah, I lost my pointer, so I have to go back and forth. It's really annoying. Let's see if I can figure this out. Okay, so dating back, we know for a really long time from animal and sort of human studies, testosterone is linked with sexual libido, sex drive, in both males and females. So orchidectomized males, this means the testes are removed before puberty. There's no sex drive, and there's no secondary sex characteristics. Remember, we talked about all the characteristics that happen at the time of puberty. Those don't develop. They actually do not go down that pathway of development. There was a lot of eunuchs, and this was in places like in ancient China and Egypt, where the young males before puberty were actually, the testes were removed, and so before puberty, this would prevent all of those traits of deepening of the voice, growing of the genitals, growing of body size. They had a higher voice. A lot of times in history, basically, they were used to sort of be a part of the palace or the royal family, and they would never have any desire to have sex or coitus with important sort of royal people. It was also, there have been eunuchs in different places for singing, so it keeps their voices sort of higher, and they're involved in various aspects of sort of the culture, and usually not very sort of, I don't know, subservient sort of positions. And I don't think it was really actually along with their choice or their allowing it to happen. They did it to very young people. That's an example from Egypt, a eunuch in Egypt. Orchidectomized, if individuals have testes removed, the reason we're talking about testes is why? Testosterone. That's where the male testosterone comes from, right? It gets converted to estradiol in the brain, but it's surging throughout the body from the testes. If an individual has their testes removed after puberty, they'll have a slow loss of testosterone over the next couple years, a loss of libido, and a loss of erection capacity. So over time, especially after puberty, all those things are going to halt and go away. So increased testosterone, that's just showing there's sort of a history there, what human beings have done, and removed testes and found that greatly affects sex drive because it greatly affects testosterone in the body. And it changes sort of the overall physiology and then future sex drive of that individual because they're lacking that hormone. That's why I was kind of bringing those up. So increased testosterone, we know it decreases the time to achieve erection. Bless you. But if you have excess testosterone, there's no excess sex drive. And this is kind of a myth. A lot of people think, oh, you have a lot of testosterone, you're more aggressive, you have a higher sex drive or a bigger libido. That's not true. Research actually doesn't show that. There's very few studies that will show if you have above a certain critical threshold or really high testosterone, you're going to have a bigger sex drive. Doesn't hold up. But it is true that if you have more T in general, it'll decrease the time to erection and you'll have normal libido or normal sex drive. As long as you're at a critical window, a critical level. Men actually have a daily rhythm of testosterone that peaks in the morning. So typically, in younger men, it's more prominent because they have higher levels of testosterone in general. But if you can see, this is the time. Here's sort of the morning hours, 6 a.m. to 10 a.m. peaks in both older men and younger men. And a lot of studies have looked at this subsequently and found that there is a diurnal, what we would call a diurnal rhythm of testosterone. Women with decreased sex steroids, so especially testosterone or androgens and estradiol, often have decreased libido or decreased sex drive. Again, showing the role that androgens and estrogen have in libido. And this, we see this a lot with women. Where would this come up quite a bit? Potentially. Yes, Cody. Menopause. Women that are going through the perimenopause, starting to get really irregular and entering menopause, and then subsequent stages of menopause on, often experience this. A decrease in sex drive, libido, lack of desire. That during that period of time, the estradiol levels and androgen levels are dropping greatly, right? Because the ovaries, the follicles have run out. In the female, what makes the majority of the estrogen? The estradiol. You guys know it about the men, but you don't know it about the women. The follicles, Alex, yes, Alex said it. The follicles, the cells, the thousands of cells that surround the developing oocytes, that's what makes up the majority of a woman's estradiol. Menopause, those are gone. Those are gone. So those sex steroids go way down. So there is a correlation with libido for women as well. All right, human sexual response and orgasm. We're going to go through those first in the female and then in the male. We'll do them one at a time. So I'm going to move this over here so that I don't have to keep going back and forth all over the place. All right, so there was some original scientific studies, and really what they were doing is Masters and Johnson were doing studies on the actual sexual response and orgasm and trying to actually measure what in the body is happening during these different stages. Okay, and it's grouped into the kind of 4 overall stages. Uncovered a lot about what we know today on the human sexual response, focusing on the biology of what's happening. So in both sexes, the human sexual response has 4 phases. We've already talked about this. It has the excitement phase, which involves all of the arousal and erotic stimuli and components that we've been talking about. The plateau phase, orgasm, not always, and the resolution phase. Those are the 4 phases of the human sexual response. Female phase, so we'll go through. This is excitement. This is the beginning. Vaginal lubrication happens, so fluid leaks out of blood vessels that are in the vaginal wall, and it creates production of fluid, a little bit of fluid. Widening of the vaginal cavity, so the vaginal introitus, the cavity itself, starts to widen a little bit. There's something that's called vasocongestion. This is the pooling of blood in blood vessels. So blood is going to those reproductive areas. Okay, so blood is starting to pool. We will call that vasocongestion. Anytime in biology you see the word vaso, what does that mean? In Latin, it has a meaning. Almost everything in biology is rooted in Latin terms. It means vessel. Vaso means vessel. So vessels are getting congested. They're filling with blood. Blood is going to these areas of the female reproductive anatomy. So walls of the vagina engorge with blood. They get darker in color. The labia minora increase in size. So there's some size changes and color changes that are happening to the external reproductive and internal structures. Continued excitement. The shaft of the clitoris increases in diameter. Again, because there's vasocongestion. There's blood going to that area and pooling. Swelling of the clitoral glands, again, due to vasocongestion. Labia majora tend to flatten out and part from the midline. Nipples get erect, size of breasts increase, so the tissue, a lot of the tissues are actually having a little bit of vasocongestion and swelling of fluids, so they change in size. There's something called sex flush, and this occurs where areas of the skin get pinkish or reddish, and there's usually dilation of blood vessels or capillaries, and so it makes the skin look reddish or pink. Happens in about 3/4 3/4 of people that were studied in some of these studies. And then there's an increase in overall muscle tension. So overall sort of muscle, skeletal muscle tension, there's some sort of increased tension throughout the body. So this goes through the phases, the diagrams, the excitement phase, and then we'll get to these other three. But just starting here, that's the vagina, that's the uterus. The uterus actually starts to change position as well. It kind of goes more in the tilted upward direction instead of being anti-flexed forward in the usual position. The vaginal opening sort of widens, and this ends up lengthening. The vaginal canal ends up lengthening a little bit as it goes further. There's lubrication, fluid that's actually produced, coming specifically from inside of the vagina. Okay, so the plateau phase. So continued along with that, increased vaginal wall and labia minora engorgement, and this is actually referred to as the orgasmic platform. So the vaginal wall itself and the labia minora continue to have vasocongestion and sort of swelling. So it's referred to as the orgasmic platform when we talk about the vaginal tissue. Both the body of uterus, as I mentioned, starts to elevate, increasing the length of the vagina, so the actual length increases just by a little bit. Size of the vaginal cavity itself is reduced. So it's thickening here, so it serves to sort of decrease the diameter of the vagina and increase the length. Does that make sense? And these were studied, by the way, with all kinds of crazy electrical probes, anatomical sort of measurements, so they could measure exactly what's happening, measure the contractions even that happen in the next phase that we're going to talk about. So they try to do it in a very mechanical, systematic way to get all these measurements. I don't know if I'd want to be willing to be a subject in one of these studies. I don't know, but they got a lot of people who are willing to be subjects. So then the clitoris actually retracts, or depending on the individual, protrudes slightly. So the actual clitoris, the body of the clitoris protrudes slightly, can be referred to as sort of female erection. There's a little bit because of the vasocongestion congestion that's happening. And then there's continued uterine fibrillation and elevation. Fibrillation means there's kind of waves of movement and shifting up of its position instead of anteroflex, it's kind of straight up. And then based on the body and what's happening to the physiology of the female body, there's an increase in heart rate, there's an increase in blood pressure, and there's an increase in respiration rate. So all of these vitals basically during plateau phase and even in the beginning starting in the excitement phase, all these vitals are starting to go up, okay? So what branch of the nervous system might be involved in this part right here? Oh my gosh, that was not intentional. What part of your nervous system might be involved in this response when we're looking at increased heart rate, increased blood pressure, increased respiration rate? Cardiovascular, yeah, that's true, because the heart and the blood vessels and stuff are doing that. That's right, but from the nervous system, controlling the cardiovascular system. Remember we talked about this a little bit?
Sympathetic nervous system?
Yes. Sympathetic or fight or flight nervous system. Branches of nerves that are coming from the brain, going down to the body and saying, hey, okay, speed up, we're doing all this. And remember I referred to this, I don't know, I think I told you guys this last time. Right? Remember? Okay, that's where this is involved. This isn't an emergency, this isn't frightful, right? It's part of that activation coming from the brain. These are normal. You want to get blood there, you want to get oxygen there, you want to speed up the lungs, speed up the heart, get everything moving. Okay. So if we go a little bit further, continued sex flush, muscular tension, etc. Okay, so this is just to show you a little bit of that engorgement of the clitoral tissue or erection of the clitoris. So remember the shaft is here. There's the preface of the clitoral hood that goes right over it. It's covering. So only the glans clitoris is exposed. What happens is it engorges and fills this spongy tissue called the corpus spongiosum. It fills up with blood and engorges, and so it ends up kind of filling up. All those sinuses fill up, and it ends up sort of protruding a little bit more, being a little bit larger in size. So these are all sort of filling up with blood and experiencing vasocongestion. That's occurring during excitement phase and plateau phase. Okay, so that's just to show you what it looks like. I have to get rid of little random spatter spots everywhere that bother me. Okay, so female orgasm. Orgasm actually in Greek, orgasmos, means climax, okay? So climax, really in Latin, it's to swell or be lustful. That's what the term actually orgasm comes from linguistically. One of the most intense and pleasurable of human experiences, as it's been described, as many people have described and have experienced. It occurs typically about 10 to 20 minutes after continued stimulation or intermission. So somewhere right around there is sort of the average of looking at many different people. So basically, this phase right here, it's short. The other ones are longer. This one is shorter. So it's strong muscular contractions in the outer third of the vaginal wall. And these were measured with transducing probes to actually, in multiple people, to see exactly when the contractions occur, how long they are, and how they're spaced apart. The first of those muscular contractions of the vaginal wall is about 2 to 4 seconds in duration. The following contractions are at intervals of 0.8 seconds. So afterwards, about a second, any subsequent sort of vaginal contractions. And typically there's anywhere from 3 to 15 of those muscular contractions. I know this is very scientific, isn't it? Mm-hmm. It's the numbers and but this is what has been sort of measured. This is what's describing the underlying physiological response and what's happening. Can I say it again?
Yeah, or just like, could you explain it? The second thing.
The contractions?
Yeah.
So the actual state of the orgasm, what it is it's vaginal contractions, and they actually affect other surrounding areas as well. Smooth muscular contractions that are occurring in a series of waves. The 1/3 sort of outer vaginal wall is actually contracting, not by your doing it. It's involuntary, based on all the stimuli that's been happening. And the first contraction is about 2 to 4 seconds, and then at intervals, it contracts again, typically anywhere from 3 to 15 times. And it's at 0.8 second intervals. So it kind of starts, stops, and starts, stops. It's like a repetitive sort of motor pathway that's happening. That's the underlying mechanism. That's exactly what's going on. So, and I always get people asking, how do you know if you've had an orgasm? You know if you've had one. There's absolutely no, I think maybe, sort of, I was like right there. That's called plateau. Okay, that's called plateau. Like you're right at the zone, but not quite. And then down. It's like, you will absolutely know. It's one of the most definitive things. There's no, yeah, maybe, sort of. No. Does that make sense? Okay, so that is actually what's happening regarding the muscular contractions. Probably never talked about this in a course in your entire life. Yes, I realize that. Okay. But I feel like some of these things are very important for people to know, and they just don't know. All right, so the rectal sphincter, hello? The rectal sphincter can also contract at 0.8 second intervals. That means 0.8 seconds, about 1 second, and then again. And at 0.8 seconds, and then again. But it's very quick. So it means that the smooth muscle in these parts of the reproductive anatomy actually will contract. And it's involuntary control. The brain is not doing it, right? The body is now responding. The inner 2/3 of the vaginal wall actually expands. So the inner part of the wall sort of expands and opens up a little bit. There's rhythmic contractions as well, typically of the uterus. So those smooth muscle contractions that lie in the vagina, I think I'm losing people, spread, I'm sorry, spread out to the uterus, and the uterus actually has contractions. So it's like the whole pelvic floor and reproductive organs are actually having muscle spasms, if you will. Okay, so there's internally, that's what's happening. And notice here, I didn't mention this, oxytocin is released. Okay, oxytocin is released in that sort of surge of those uterine contractions, surge of oxytocin from the brain, and it's this little feedback system that just happens. So you get a blast of oxytocin with an orgasm. Okay, so similar to with kissing and touching and all these other things, you get a big blast of it. There's the peak in heart rate, peak in blood pressure, and respiration rate that is sort of maximal now at the orgasm state. So strong involuntary muscle contractions, again, involuntary. These are affecting the skeletal muscles, not the internal reproductive structures, but the outer part of your body. Often there's these involuntary muscle contractions and motions like clutching and clawing or grabbing. Very common. So these are commonly going along with the reproductive contractions that are happening inside the body. Was there a question you had?
Yeah, it was just about pretty much all this. This is all pertaining to just one orgasm, where it's possible to have multiple.
Oh, we're going there. I'd love you guys go exactly right where I already got that in here. Okay. So we will talk about that in just a second. I'm losing more people. Okay. There's no refractory period. Okay? What is a refractory period?
Isn't it
Cool
like a
down.
break?
Okay, I like to use cool down break. So in biology, when you hear the word refractory period, that means there's a certain set period of time where the system has to reset. It cannot happen again during that period. I'll give you an example that's kind of gross, but it always works for me learning this in biology. If you flush the toilet, can I flush the toilet again immediately?
No.
No, and I've been in trouble from that too. Like, oh, dang, it didn't go down. I can't flush it again. Refractory period is there's a flush, there's a response. There's a response, and you have to wait for the system to rest. The fluid has to come back in the toilet. The ball has to come back. Then you can flush again. Okay? I've learned this. I've had to fix toilets, and I've been in potty situations that are not fun. So refractory period of time before you can have it again. Okay. Females don't have a refractory period. That's where I'm going. And that's where, Lex, that's where your question implies. There could be multiple orgasms that are literally back to back because there is no refractory period. It doesn't have to set, rewind, get to baseline, start all over again. It can go again. Okay. And we'll talk about the stats, the numbers of that in just a second. So different types, A, B, C. These are different types of female sexual responses and patterns that can be had. Going from A, which goes excitement, plateaus up, has an orgasm, has another orgasm, and then goes back down. Resolution, back to baseline. There's another individual who goes up, plateau, right? Excitement, arousal phase, plateau, never goes here, stays here, and then goes down. Resolution. There's a third example where they sort of have peaks and troughs of going up, achieving sort of plateau orgasm, kind of merge right together, powerful, and then straight down. Okay? So these are three different variants of how those four phases can fit together based on level of sort of arousal throughout the different phases of the sexual response. So that's we'll talk about some of this. Multiple orgasms, is that myth or reality?
Yeah.
It's reality. Okay, so it's not a myth. It's a true thing. All right, 14% of women have multiple orgasms, probably more are capable. And actually, I would probably say not probably, but definitely more women are capable. Based on the physiology, the anatomy, and the body, totally possible. There's no refractory period. The female body doesn't have to reset and go back to baseline before it can experience the muscular contractions again. It's just not built in to the body. So that is actually possible. Okay. Later orgasms in the series are typically more intense. So if someone has multiple orgasms as this part of the phase, usually the later ones or the last one is the most intense than the preceding one. Status orgasmus, this is a little weird, it's very rare. It's a sustained orgasm lasting up to a minute.
A minute?
Up to 60 seconds, give or take, yes. So this is a long time for that. That is atypical. I will say that is very atypical. It's very rare. Okay, female orgasm experience. Do all women have orgasms with sex? And a lot of this is where we do the myth busting and talking about myths.
No, they do not.
No, they do not. Nope. They actually, a lot of the studies and numbers are all, I tried to kind of take the averages and kind of summarize based on what all the studies have sort of found. 1/3 of women seldom or never reach orgasm in coitus. 1/3. It's about 33%.
Like just during
Penetration?
Yep.
Penetration?
Or I always thought the number was higher. That's crazy.
Wait, are you
No, this is,
penetration though? Like if there's
That's rare.
yes. 75, yes, exactly. So just with coitus penetration, okay? 75% of women never reach orgasm from just intercourse alone, from just penetration alone. There has to be something else going on, another factor, another component. 15, so this is kind of even lower now. 15% of women never achieve orgasm, and this is not even with masturbation. So this is 15% of women that actually never have and cannot do it even with self-stimulation, okay? So 75 is about 3/4, and that's the one you were referring to, Lauren. This is why it's higher. It's because they can't achieve orgasm just by intercourse alone. Different types of coitus, right, has to be interplayed into that equation in order for it to happen. And I realize this is weird. What I'm trying to say with this is that this can change. It's weird, I know. But it's a Rubik's Cube. And the reason is there takes some figuring out. It takes some figuring out, even just based on the individual themselves, and then any partner or partners that that individual has. It takes some figuring out. And actually based on mindset, emotional state, awareness, erotic stimuli, all these other things, it can affect the response and the ability to achieve this phase. All of those things are at play. And even in one woman, over time, the necessary components may change. Do you see what I'm saying? So it's confusing. It's sometimes, so a lot of times this comes with self sort of exploration, exploring with a partner, and sort of some experience and wisdom of figuring stuff out, because it is a little bit like a Rubik's Cube. It is like always changing. It always changes.
And it's different for every turn is different for every woman.
Every turn is different, and it's true. So among women, there's a lot of variability, and even in one woman, over time, there's variability because of the sort of mental aspect of things too, right? So all of that information feeds in and makes this hit or miss, honestly. Like sometimes for many individuals, that's why there's a lot of struggle. More about the experience, it varies within women and between women, as I said. Oh, we're running out of time. There's an original study, it looked at, some of these original ones were the first ones to sort of explore orgasm, like what's happening and what's happening with sexual response. Women described it as suspension and intense sensual awareness of the clitoris up to the pelvis, warmth of the pelvis to the rest of the body, so like a change in heat, almost temperature feeling, pelvic throbbing, so again, those muscular contractions, you can perceive those of the vagina and the lower pelvis. Other experiences that have been reported in the original studies and subsequent studies, mild twitching of the extremities, body rigidity, so stiffening up of the body, facial grimacing, groaning, screaming, even laughter.